Hey there, Storz Medical. Welcome back to our video series, and today I'm going to show you a live demonstration on shockwave therapy using radial and focused shockwave for the neck. So stay tuned, this is going to be pretty cool. If you're new to our channel, please subscribe, give us a thumbs up, and I got lots to share. Stay tuned. Before I show you the actual demonstration, every case that we see has been analyzed with X-ray analysis. And we go through all the data to show us exactly what's wrong with the spine, what's wrong with the neck, if there's instabilities, where they are, and what kind of treatment those joints need. If the joints do not need any type of cellular injection, then the shockwave is a great standalone therapy. If they do need additional care, meaning that they do need to be injected, whether it's prolotherapy, PRP, or stem cell, the determining factor for that is, again, the assessment from the X-ray analysis itself. So now I'm just going to show you how we go about treating the neck with shockwave therapy with both radial and focused shockwave. What I'm doing now is just putting some nice warm gel on our patient here on the neck area, and we're going to start with some shockwave, some radial shockwave with a D20 tip. And Mark, you let me know if this is going to be okay. How's it feel for pressure? Good. All right. So typically what we want to do is for discomfort level, we want to make sure that we're from 0 to 10, 0 being nothing and 10 being an ice pick. We don't want any more than a 2 or 3. And what would you say your number is here, Mark? What is this? 1. That's a 1. Okay, great. So that's okay. And so what we're going to do, we're going to be going up and down the paraspinal area all the way down to about T8 or T9, down to about this level here, up to this area through here on the, so I'm working on the trapezius here. This is the levator over here, rhomboids, minor, rhomboids major, the paraspinals through here, the trapezius, and we're going to be doing both sides. I'm going to do a little bit on each side here just to kind of give you an idea. And right now we're just generally getting some blood flow going through the area. And the neck portion I'm going to do after I finish this area here. And what we'll do, I can feel through the instrument when I come to a trigger point area, like probably right around there. Yep. So I'm going to hold it on this trigger point for really just about 500 pulses or so. This trigger point right here is right in the levator area, which connects the shoulder blade to the neck area. And just think about this as we're taking a meat cleaver and we're going to tenderize a piece of meat. And how does that feel in there? Awesome. Feels pretty good? Okay, great. So Mark's done this many times, right? We've done this quite a few times, right? Yeah, right. And so you can start to see the skin getting red as we're starting to stimulate the tissue. Alrighty, so now what I'm going to do is I'm going to switch gears and we're going to work on the spine next. And now what we're going to do, we're going to work on the neck portion itself up into the suboccipital area here. And you can see here, this is the size of the tip that we used the first time. This is the D20S tip. And then you can see that the diameter of these other tips are a little smaller than this guy here. And then when we look at these tips, we see that this one in my right hand here, this one here is flatter. This one is a rubber tip. This is a metal tip. So the rubber tip's going to be even a little bit softer. So depending on how much tenderness there is in the neck, how chronic, how much discomfort the patient's having, we can change the tips out to accommodate the patient tolerance. So now we have on here the D15 tip. We're going to go into the neck area here. I'm just going to do the one side Yeah, you'll see it better on this side here. So I'm running along the side of the spine here with the Shockwave, with the Radial Shockwave, up the paraspinals, over the joint area, all the way up. So we're starting at C7, C6, C5, C4, C3. This is C2 right here. And we're getting up to C1. How's that for pressure? You okay with that?
Great. Yeah.
Okay, great. And now what I'm going to do is I'm going to work in the suboccipital area. So the suboccipital is the area between the base of the skull and C1 and C2 through here. So most of your rotation when you turn your head is coming from this area of the spine, this upper cervical spine area. When we're having headaches, migraines, dizziness, balance issues, it's coming from this portion of the spine here. How's that feeling there?
Good.
Feels pretty good? Alrighty. So I would go through a whole process here, and now what I'm going to do, I'm going to switch tips again, and we're going to go on work on the spine. So you've seen this instrument before when we do our adjustments. We have a video on this and how the instrument works. Well, if you look at the tip of that, this is the radial head here, you'll see that the tips are very similar, right? And so what we're going to be working on is, just like we would do the adjustment with the instrument here, we're actually going to be working the radial shockwave through the spinal areas with this unit right here. Here we go. You ready? There we go. How's that for pressure?
Good.
Good?
Okay.
All right. So I have it at a tolerable pressure for to work on the vertebrae. The frequency is at 10 hertz. The vertebrae are between 4 and 12 hertz. So this is a faster, towards the faster end of the frequency of the vertebrae. And we would work our way all the way up the spine here. This is going to be C5, C6 right here. C4, C5. How's that feeling right there? Are you okay with that?
Yep.
And I can control the pressure again, or the intensity, how much energy is going into the neck. And we want to make sure that we're going from a 0 to 10, no more than a 2 or 3. And we would work our way all the way up and into the suboccipital area, like right up into this area through here, all the way up in the suboccipitals through here as well. Okay, good. As you can see now, we're using the focus unit. Obviously it looks quite a bit different. We just finished doing the spinal area of with the radial shockwave, and now we're going to be doing the focus. And the difference with the focus is we can get a lot more energy into a very specific area. So as we're working on the cervical spine here, any injuries that have taken place in the neck area, this technology, this amount of energy coming from the focus unit is going to be able to get down to the ligament area. We can actually start to, more or less, I like to say, knock on the joint door here as we get into this. So here we go. So it has a completely different sound than the, and I'm just holding this so you can kind of see where it is on the neck there. But we're able to get down. You okay with that?
Yep.
Yeah, okay. So we're able to do different things. So if someone has numbness and tingling going down their arm, we're able to do a technology called neuromodulation, which is a very low energy coming from the focus shockwave, but actually stimulating the nerves to actually reduce the inflammation and start the healing of the nerve tissue. And so people that have pain down the arm, numbness, tingling, burning pain, sharp pain, achy pain, stabbing pain, shooting pain, throbbing pain, all those different sensations, this focus unit area is phenomenal, absolutely phenomenal for that type. So we would work all the way from trigger points up through here, stubborn trigger points that aren't getting cleared up with the focus unit, all the way up to facet joints, instabilities, working our way all the way up to the suboccipital area. We can even do C1, the joint, the TMJ joint with this, the mastoid process here where the SCM attaches, so there's no limit to what we can do with this. This piece of technology is absolutely phenomenal for truly healing the neck area. And now what I'm doing is I'm taking the instrument adjusting device. After we've done the Shockwave on the spine itself, now we're just adjusting those vertebrae to reset the nervous system, reset the joints, and you hear how fast that beep is. These joints are moving a lot better, a lot smoother, a lot faster. And after we do the adjustment, it's like a control-delete on the nervous system. This is how we finish the treatment with the Shockwave, is doing the adjustment portion. Beautiful. As you can see, treating the neck with Shockwave is fairly extensive. But again, we keep raising the bar here at Ultimate Medical Group, trying to find new technologies that help us improve patient outcomes. And this combination from Storz Medical of the Radial and Focus Shockwave to treat the neck, again, allows us to continually empower people to live their best day every day. So until next time, have yourself a blessed day, and we'll see you next time.